The title of my talk is, How Did We Get Here and Where Do We Go From Here? It's a brief history of the American healthcare system. At the beginning of the 20th century,
there was no remote control.
At the beginning of the 20th century, there were no remote controls. There were also no manual controls. All right. At the beginning of the 20th century, care was either provided as a fee-for-service directly from providers or through nonprofit insurers, but many of whom had religious affiliations. Most patients in the United States consume very little health care, mostly end of life, really. As you know, and a lot of you know, how high youth mortality rates were in the early part of the 20th century in the United States. Treatment was rudimentary and often desultory. Frequently, there weren't a lot that doctors could do. Doctors could set bones and do some high-risk surgeries, but until 1940s, there weren't a lot of heavy remedial technologies in healthcare. And in the 1940s saw a cascade of important remedial technology: penicillin, sulfa, plasma, trauma surgery, and I'm probably missing some. But this dramatically increased the scope of diseases and injuries that could be treated effectively. And this was an extremely important development because it happened right about the same time as this development. During the Second World War, when all of those technologies received a huge workout and were incredibly refined on the battlefields of Europe and Asia, there was an incredibly tight labor market. 18 million men and women served overseas, and there was a threefold increase in the demand for labor of 14 months between 1941 and 1943. There were federal laws to cap wages and prices. So the federal government did a deal with major industrial insurers. Major industrial employers. They could offer tax-free health insurance to compete for employees, and this created the system that Truman inherited when he made his first attempt to create a national health service in 1947, an employer-based system. That didn't happen. The AMA shot that down. So they went at it another way. Walter Reuther and the UAW negotiated with GM what was called the Treaty of Detroit. And it said that UAW union members at GM plants would receive health care and retirement benefits for their members, and it set the level of wages. And industries all over the United States copied this deal. This was the beginning of the de facto collective bargaining system. It's also the beginning of the industry-wide employer-based health care system that we inherited. Now, in the 1970s, the rules for taxability of benefits were codified in the Employment, Retirement, and Security Act of 1971. Nixon made sure that there were plenty of incentives for employers to prefer managed care services, which included coverage through HMOs. And the thought was that if care could be limited, then costs could be controlled. But even though care was limited, costs continued to spiral out of control. And for the first time in the 70s and 80s, what many people had taken for granted with the system of lifetime employment and employer-based benefits became inadequate. And a lot of people began to develop some insecurities about the benefit system. And this was helped along by the two major recessions of the 1970s, which reduced the importance of manufacturing in the American economy. So with that, the economy began to be filled with service jobs that were frequently without benefits. And so the system that was built in the specific circumstances of war began to unravel. That unraveling accelerated in the 1980s when business and government cooperated on union busting. Many of you remember the PATCO strike of 1981, and that was pretty much the signal for a pell-mell of state and federal laws and corporate policies labor unions in the American labor market. That had a profound impact on benefits in every sector of the economy, and dramatically reduced worker security. And it was at this point in the mid-1980s that we started to see the increase in the number of uninsured workers that has brought us to where we are today. Which is that we have 49 million Americans who have no access to health insurance whatsoever, and 55 million additional Americans are insured in name only. They are not, in fact, insured in any significant way. If there's a major illness or a major injury in their family, they will face substantial financial hardship, and Troy has a story to relate along those lines. So the issue is deeper than the uninsured, and that number of 49 million is probably right now closer to 52. But there's no hard numbers on that. But and of course, those suffering from chronic diseases may not be able to get any coverage at all. There are also people with chronic diseases are locked into their jobs, and the spouses the spouses and supporting family members of people with chronic diseases are locked into their jobs. There are tens of thousands of Americans who don't start a business every year. This is the only reason. It's not access to capital, it's not access to client base, it's not access to marketable skill. This is the only reason. So we are losing billions of dollars in lost productivity and lost new businesses every year because the employer-based system no longer does what it was set out to do, because we have no lifetime employment in the United States anymore. All right. As a result of these changes, one study estimated that 22,000 Americans suffer premature death every year because of lack of access to health care. Now, that's a dry statistic, right? 22,000. We see statistics like that all the time. We're used to it. How many is 22,000? That's 7 9/11s every year. What do you think would happen to this country if we had 7 9/11s every year? It's also a 747 crashing every week. Now, if a 747 crashed full of passengers in America every week, do you think anything would happen as a result? Think there'd be a change in aviation policy? I think there probably would be. What is different about this is that it's quiet. It happens in hospitals, it happens in homes all over America. It's not violent, it's not flaming, it doesn't happen in front of a camera, and so it doesn't click with people. And there's a common problem in sociology.